It's probably a combination of both. But definitely you can see a family history of diabetes, type 2 and type 1 in some large families.
So is it a definite that because, say, my dad was diabetic, would it be reasonable for me to assume that I'm going to automatically be diabetic?
Not automatic if you take the steps to avoid it.
Okay.
If you follow a path of eating habits and activity habits that are very similar to your parents, well, the apple doesn't fall that far from the tree.
So what I hear you saying then is that we pretty much control that by, for instance, I'll just use an example: the foods we eat at church.
Yes.
For
Great example.
a good dinner at church. You know, we got the greens with all the meats,
right,
and the pigtails and the ham hocks and the grease,
macaroni and cheese,
and all this is together.
Rice.
Yeah, and it's all at the same time.
Yep.
White rice, and then you got cakes, and you got pies.
Yep.
And what we're doing is we're putting all this stuff on our plate
at one time, and then we take home a plate.
And we take home a plate and eat some of it before we go to bed at night.
Right.
So what have we done?
Yeah, that's the perfect storm.
What have we done?
Right.
You said it's the perfect storm.
That's the perfect storm. Yeah.
Okay, so that storm is gonna
simple carbohydrates and a combination of fats. That's the perfect storm to give yourself insulin resistance and therefore diabetes.
And diabetes.
I mean, if you couldn't design a better meal for that purpose.
For that purpose.
Right.
And so then you wonder why 5 or 10 years later you end up diabetic.
Right.
And you wonder where it came from.
Right.
Or what about heart disease and some of the other things that are complications from diabetes and our diet, and we wonder where it came from years later.
They all mix in together.
They mix in together.
Every last one of them. They all mix in.
So we have got to be more cognizant and aware of where, and I call it intentionally aware and being intentional about our eating. But my motto now is be intentional anyway, because we have to be intentional with our spending, with our family lives, pretty much everything we do.
Right.
Because if we don't plan, then somebody else has a plan.
That's true.
And oftentimes that plan is the enemy.
That's true too.
And if we don't, what does the Bible say? Don't be evil. Don't be ignorant of his devices.
Yes. And the food, if it's used inappropriately, the food could be a device of the enemy.
Could be
right.
I like that.
Yeah.
Could you elaborate?
Well, all these multi-billion-dollar corporations that manufacture so much of our food, and I did say manufactured. You don't think about food being manufactured. Food is grown. Food is organic. We live in Georgia. I mean, maybe some of our viewers don't, but we're in Georgia. You can drive 100. You can drive not even 100. You can drive 20 miles outside of town and pass by a field of cows or a field of some growing vegetable crop. You haven't got to have food imported from another country, where it was picked when it wasn't ripe and on a container ship and shipped here, or you haven't got to have bread that was manufactured in a factory and given chemicals so that it would have a nice shelf life.
Right.
I mean, you could go to the farmer's market, not that far from here, and get fresh, locally grown food.
Yes.
You could stop by one of those fields I mentioned and ask a farmer, well, how much to raise this cow for me, and I'm going to slaughter it, and me and my neighbor are going to split the cow. So we're going to have fresh, non-hormone fed meat in our freezer.
That's an option. Yeah.
Yeah. You can do that if you have a decent sized freezer. You could do that.
Okay.
And you could ask the farmer, what do you feed your cows? Grass. Okay, so there are no hormones. Do you give your cows antibiotics? No. Okay, so that means you're not going to be introducing antibiotics into your body that stay stored in your fat, because that's where it happens. That can then lead to bacteria, that you might get exposed to at some point, being resistant to those antibiotics that you ate, unbeknownst to you, leading to a disease that you already had resistance to the antibiotics. So
Okay.
you get sick with pneumonia 2 years from now, but you're resistant to the antibiotic, or those bacteria are resistant to the antibiotic because you've had the antibiotic in your system from what you've been eating all these years.
So this is a very complex,
Very, very complex.
very
system.
complex.
But I mean,
yeah.
we've been sabotaged for years by big business. So I mean, I won't name names of companies, but why are there more of certain fast food companies locations in poorer neighborhoods? You haven't got to name them either. I mean, everyone there's some you can drive by 50 locations in town.
And that's true, because the assumption is that, number one, poorer people, and that's a whole nother discussion, the poverty discussion,
Right.
because that's a whole landmine.
Well, all these things, all these
Yeah.
bad things, why are they located by poor people? So you could say landfills. You could say, why are the landfills in the poor neighborhoods? Why are the dialysis centers in the poor neighborhoods? The poor and people of color neighborhoods. They make it very convenient for you. Those are the main medical facilities in town that are on the bus line, or the dialysis centers. They make it very easy for you to show up for your dialysis after you've killed your kidneys eating the wrong stuff.
So they make you sick, then they provide some way.
It's
for
very
you.
convenient.
Yeah. And so that is basically saying we have to be our own advocates. We have to be aware and be good stewards of the
Of our
body
health.
and of our health that God has given us.
Right.
When I think about stewardship in the Bible, in the book of Daniel, for instance, Daniel and the three Hebrew boys were good stewards, because what did they say? We're not going to eat all that stuff. We're going to eat what God has provided for us, because we don't want to pollute our bodies. And what did they basically tell him? Feed us what we're used to.
Exactly.
Come back in a few days, and then you compare us to them.
Exactly.
And see the difference. And God was faithful.
Yes, he was.
He was faithful, because what did they say? They were smarter. They were stronger.
They were healthier.
They were healthier in everything. And so basically, this is what we need to do today.
That's true.
God has provided, and then the Bible says He has given us everything that we need when it comes to life, when it comes to godliness, when it comes to all the things we need. God's already provided. Health, healing, everything that we need, God has already provided for us. We just have to make ourselves available and avail those things. First of all, we got to be knowledgeable, because we got to know what the Word says.
True.
And then we can avail ourselves of what's available to us. Now, you were talking about riding through the fields and seeing corn and different things.
Right.
Corn, alcohol.
Ooh.
Alcohol. What is the role of alcohol when it comes to diabetes? Can diabetes be affected by alcohol?
It can be made worse by alcohol. Alcohol is mostly empty calories. Now, I guess if you're talking about a pure spirit product like like straight vodka or something, there are not a lot of calories in that. And calories usually from alcohol are simple calories. So beer, less alcohol content, so there are more calories in it, because less of the grain used in making it has converted to alcohol. So lower alcohol content equals higher calories. More calories equals weight gain. So the beer belly is a real thing. But alcohol of a higher alcohol content, vodka compared to beer for this example, the vodka is not really better, because the alcohol goes through the liver to be to detoxify. So that same liver, that same organ that's trying to work on your overloaded diabetes, So no, there's no healthy benefit to any form of alcohol for a diabetic. So sorry.
Wow. Okay. So just putting that out there.
Yeah.
Now, what about? I'm trying to get in some questions that people have asked me.
Okay.
What about when you're sick, and you have? Because I know I've heard people say that when they're sick, their levels are out of control, or that if they were pre-diabetic, or I guess lower ranges, but when they go into the hospital, for instance, they are put on insulin during that time or whatever. Could you talk a little bit about that?
It's kind of a complex question, because it kind of depends on what sickness tips that person over. But some people, if they're a known diabetic and they become sick with, let's just say, a really bad cold, a bronchitis, their blood sugars might be better because they might be eating less.
Mm-hmm.
Yeah. Or they might eat healthier foods while they're sick, just
Mm-hmm.
because, they get told, all the different old wives' tales, and some of them actually for a cold might actually be right.
Mm-hmm.
So that person might have an improvement in blood sugar initially. Then of course they feel better. They go back to what we call our pre-morbid behavior,
Mm-hmm.
and they go back to eating the regular foods, and then the blood sugar spikes back up. And then if you contrast that with a person that say has the stomach virus, they can't get near enough foods in. Blood sugar might spike if they're taking lots of liquids, Gatorade, things with sugar in them.
Mm-hmm.
Blood sugar might bottom out if they're doing those same liquids, but they're still taking their diabetic medicine.
Oh, okay, okay.
So it really kind of depends on, or how should I say it? If you're having an illness and you're a known diabetic, you need to actually speak with your physician about what's going on with you at that moment, and how to adjust your diet to anticipate what your blood sugar might do.
Okay, okay. Because and I think in the class what they were telling us also was you have what they call I think they call it a illness kit or something with certain things in it, like.
Well, yep, that's more for like a person that takes insulin, but it wouldn't be a bad idea for just a well-informed diabetic to do for his or herself if they felt an illness coming on. But really, the good diabetics really will actually know how to adjust themselves, kind of based on what's going on with their nutrition, based on that illness.
Okay. Now, what about a log? Because if I'm sick versus I'm not sick, in terms of keeping a log and bringing it to you when I come to see you.
Well, I love the log personally, because the log, one, it's accountability. So it shows that you've actually been doing some work. Patients tend to think that, well, the doctor really, he spends that 5 minutes with me, and that's about it. But patients tend to, have trends, and so your trends might be the same as 2 or 3 of my other patients. And so I might see Susie today, and she reminds me of something that's going on with you. And then it's like, okay, well, I need to keep that in mind for the next time I see Lena, so that I can tell her this, or I can ask her, what's been going on under this circumstance? And so the log also is a visual reminder to me of, okay, well, I need to ask, what's going on with you in the mornings, or what's going on with you after church on Sundays, because we can kind of determine those patterns. And that's just kind of knowing our patients. I know certain patients, do certain things, and certainly I've walked into restaurants and especially buffets and seen patients, hide their plates from me. So, there's no point in hiding your plate.
Yeah, because it's going to show up when you come to see me.
Exactly. So, those trends that the log can reveal on paper are sometimes better than just looking at the small screen of your glucose monitor, because that little monitor, it's small. It's a lot smaller than a cell phone if for those patients or those viewers that haven't seen one. So it's only going to show one blood sugar reading at a time, and the patient and the doctor have to scroll through. But when you're literally looking at days and days worth of blood sugar readings at a time on a piece of paper, we can both look at it at the same time. We can talk about it. We can kind of interact with it. It's a moment that for the patient, they're probably happy that the doctor's not typing on his computer. And we're sitting here next to each other interacting. And hopefully that human element helps just as much as actually looking at the real data.
Right, because you can look at it and say, okay, well, Rena, it looks like on Sundays, every Sunday your sugar is real high. What are you eating on Sundays?
Okay. Yeah. Oh, I went to church, Doc. Okay. All right. Well, you need a smaller portion, or you need to not take home that extra plate. Plus, can you do a Sunday walk?
Right. Speaking of walking, exercise. The role of, because they always say move, stay active.
Yes.
What does that do for the diabetes and the sugar?
Okay. Well, let's see. The simplest answer is that going back to the very beginning, your body requires insulin to get sugar into the cells to be used. But exercise is the freebie. Exercise will decrease your need for insulin.
Okay.
So whether that's for a diabetic that requires insulin, the type 1 diabetic, or whether that's a type 2 insulin resistant diabetic, there's less need for medication or insulin in that type 2 diabetic with exercise. So the muscles usually require insulin, but when you're exercising, the muscles are able to basically respond to and absorb sugar without the need for that insulin. So they're getting their fuel without your liver, your pancreas having to do any extra work. So it's literally a freebie.
Okay.
So increased exercise ultimately lowers blood sugar. I've got one really great success story if we've got the time.
Yeah. Okay.
Okay.
In a minute.
Okay.
Yeah.
So this was a gentleman, bit older than me, bit older than you, ex-military, diabetic, hypertensive, and smoker. So he stopped smoking, and then he felt better, so he started exercising. And he started losing a little bit of weight, so we actually ended up decreasing his blood pressure medicine a little bit. And then he felt better with the walking and the riding the bike, so he started swimming. And he lost more weight, and then we started reducing the dose of his blood sugar medication. And then he swam more, and he decided he wanted to learn how to scuba dive.
Oh.
So he took scuba lessons, and we reduced his blood pressure medicine more. I think we actually eliminated one by that point, and we reduced his twice a day diabetic pill down to once a day. So this is by the fall of that year. Thanksgiving that year, he's going out of the country to dive for his Thanksgiving vacation.
Wow.
Christmas that year, he's going to move away to Florida, and I'm taking him off all medicines. So he still have a diabetic tendency, and he still needs to check his blood sugar and all those sorts of things. But he's no longer on any medicines.
Just by virtue of the fact that he's being a good steward, he's being intentional.
That's correct.
He's moving.
Right.
He is following doctor's advice,
Right.
and all of the things and he's not going around saying some of the typical things that people say, like,
I
can't do it, or I'm tired, or when you eat you get lazy, or you gotta die from something.
Oh. Doctors hate that one.
Yes, you gotta die from something, so I guess I'm gonna die from diabetes.
And you hear that one in the church so much. Why do people always say, gotta die from something?
Yeah.
That's the worst one.
It's one we use in the church.
Right.
So y'all, this has been a very rich discussion. Dr. Miller is going to be here even more. We're going to talk about other illnesses. We're going to talk about heart disease. We're going to talk about a variety of illnesses and how we can be more mindful and be good stewards of our bodies. So I thank you all for listening. For those who are on Facebook, if you stay on for a few extra minutes, we'll continue this discussion and answer a couple of the other questions. But I thank you all for tuning in. If you have any questions, then be sure to either email them to me at allthingskennedy@gmail.com, send them to the radio station, or go on my website, allthingskennedy.com. So thank you all. Be healthy, wealthy, and wise. Until next week. So we're going to answer a couple of the questions.
So we're on both these or still?
Okay,
all right.
So after it finishes, then we'll talk about that.
Email comments, encouragement to allthingskennedy@gmail.com. I look forward to our next time together.
So, I was waiting on our intro, my rollout music to go off, but I'm going to just continue with the discussion while we got Dr. Miller here. One of the things we also wanted to make everyone aware of is the need for Med Alert jewelry.
Yes.
How important is it for anybody with any kind of conditions, especially diabetes, to wear some kind of Med Alert jewelry?
I think it's great because it provides a way to speak for you if you can't speak for yourself. We used to see a lot more people wearing them, and I've even seen people tattoo diagnoses like diabetes on themselves. That's your own taste. But I mean, I do have one patient who had at least one that had diabetes, type 2 diabetes, tattooed on their left forearm.
Okay.
But whatever is done, whether it's a bracelet or a tattoo or a necklace, it's just a way of being able to speak for you in case you can't speak for yourself. But paramedics pretty much are known to check for blood sugar in any person that's not responsive, because an unresponsive patient, it could be a head injury, it could be a diabetic coma, it could be a drug overdose. So the glucose machine is quite easy to use, and that's one of the very first things they look for and do. But if the person that catches you or finds this unresponsive diabetic is not a medical person, then if you have that reminder, that visual cue that you have this problem, they can seek help without waiting for what the paramedics will do when they get there.
Right.
Because they'll probably think of giving you something with sugar in it, under the hope that it's a low blood sugar condition, and that they can make it better. And of course, if you were a diabetic with high blood sugar, that little bit of orange juice or whatever wouldn't make you any worse.
Oh, okay. So if somebody, and the thing, if you see someone that's unresponsive, isn't it better to give them the liquid glucose or something? If
that's available, I rarely see patients that even acquire it anymore. And of course, in my population, the vast majority of the patients are type 2 diabetics, and only a small percentage of those use insulin as part of their treatment. And most of my insulin-dependent, type 1 diabetics are managed by the endocrine doctors, the specialists in diabetes and endocrine disorders for the viewers. So I don't necessarily know if they possess the liquid glucose, but if you do, hopefully that unresponsive person would have their kit with it.
Right.
And of course, if the kit's there, most people are going to figure out just from the content, oh, this is a diabetic, whether you have that bracelet or not. But the bracelets are still a great idea. They don't seem like they promote them as much as they used to.
They don't. But then I've seen some. Well, I guess because here again I've been being
more intentional.
Yes, intentional, and I found some really cute ones.
Yes, right. I mean,
some really cute.
Amazon's got some great ones and things like that. But you used to see the displays for them in every doctor's office, and I haven't seen.
I don't see them either.
I might have seen them in residency, and that was maybe 25, 30 years ago. But I've never had them in any office that I've been a part of. All these years, I don't know if those companies really promote them to the doctors much anymore.
But I would, if it were up to me, I would promote them and ask people to get them. Because, for instance, on my job, I don't go around, hey, I'm diabetic, whatever. But if I had on a bracelet and something happened, then people could look and they would know that, oh, we need to do X, Y, Z,
Exactly.
Or if I had a heart problem or whatever. But if you don't have on anything that's going to indicate to those people around you who work with you every day and have no clue, then it kind of might save your life.
That's true.
Might save your life. And with diabetics, one thing is that you don't want to go sticking a piece of peppermint in their mouth.
Well, yeah.
Because you hear people talk about that. Oh, give them some. I've heard this. Give them peppermint. Well, if the person is already almost comatose or whatever, you can choke them.
Yep, right. Because they can't manage the airway.
Right. So you don't do that. So there's just such a lot of information that we need to know in order to steward our health. But it's not just about us. It's stewarding our children's health, our parents' health, because not only are we hopefully being a good example, then the other people around us will hopefully model some of the things that we're doing.
That's true. To
be healthier. One other final thing I wanted to talk about. You talked about the dialysis places and wherever.
Convenience, exactly. Yep.
And they're always so nice.
Oh yeah, there's some of the best looking buildings in some of those neighborhoods.
In some of the neighborhoods, but yet there are other things that people are not promoting as much that would make it attractive to us. So we got to make eating healthy attractive.
Right.
We got to make being healthy attractive.
Right.
That's not to say, for instance, that everybody that's obese is unhealthy. I'm not a doctor, so I don't know. But by the same token, everybody that's skinny is not healthy.
That's true too. That's very true.
So we got to do some things to steward our health. But what are we doing, for instance, if we make a conscious decision? Say, you tell me to lose weight. You tell me to exercise. And I say, well, I don't have time to exercise. I'm just going to die from something. What do we, that's basically, that's what I'm deciding, right? If I say I'm not going to do it, then I'm basically making a decision to die early.
Yeah, I mean, the devil is a lie, but I hear it every day. I'm going to die of something.
Right.
And then the next thing will be, they'll complain about the frequency of office visits. Like, well, why do I have to see you every 2 months? Because you don't do right.
Right. If you do what you need to do, you don't have to come see me.
You can see less of me.
Right. Because guess what? I'm gonna be here.
Yeah.
My office.
I'm taking care of myself. People always ask, do you go see a doctor? Yes, I go see a doctor.
Matter of fact,
and I listen to him.
And matter of fact, I was at my doctor the other day, and I saw one of my other doctors at that office seeing him. So yes, doctors do have to take care of themselves. Right. But are we being fair to our relatives and our grandchildren and the future to come if we are dying early? If we are,
we really aren't. I mean, you're talking about all these years of lost productivity. Do you want to? You said it at the very beginning, and I had not heard it before. Shaping your future. Well, you're shaping your future right now by what you're eating. And I don't sit and eat cauliflower, and I'm not a vegetarian or vegan or anything.
Yeah.
But you cannot have butter dipped, sauce covered, whatever every day.
Right.
You can't have ribs every day. You can't have 2 slices of red velvet cake and peach cobbler every day.
Every day.
You can't do it.
And our body is not designed for that.
It's crazy. So I'm not saying don't have these things that you like, but the holidays are coming. So if you know you've got a weight problem and you know you like good foods, why don't you go ahead and do some sacrificing now so that when Thanksgiving comes, you can have a normal Thanksgiving meal, and you can have a normal Christmas meal.
Yeah.
But you can have a little bit of austerity. You can have some of the simple foods that Daniel and his friends ate for that period of time. You can do a Daniel fast for some amount of time between now and the holidays.
To get ready.
Get ready, right? And not so much. Oh, I'm going to lose weight now, like losing weight for the summer. So you can look good in a bathing suit, or look good at the gym or on the basketball court. You can lose weight as a jump start to feeling better for next year because you're shaping your future,
right? And
still not have to suffer over the holidays because you've done enough work early, so that. When the holidays roll around, you eat what everybody else eats, maybe not as much, and then you say, well, family, let's go for a walk after that Thanksgiving meal.
And make it a fun activity.
Exactly.
We had a birthday party for one of my grandchildren the other day. They said, are you going to eat cake? Yes, but I had a thin sliver of birthday cake.
Right.
And I had about a good tablespoon, maybe 2 of ice cream.
Okay.
That was enough for me to know I had ice cream.
Right.
Okay.
And you didn't feel deprived.
I didn't feel deprived.
Okay.
But I was looking at everybody else's portions, and that was the portion I used to have, like the big chunk of cake. Right. And I always said, give me the outside piece. Because, I used to love it.
With the extra icing.
With all the extra icing, all the extra glucose, in other words, now I know.
Exactly.
But, and then a great big bowl of ice cream, and fat. And then, I like where you put it about ice cream the other day. What is it?
Sugar and fat.
Sugar and fat. Yep. So, I had my little portion, and I felt very good. I felt good. Right. So, I think that's what we need to do as well. Be mindful is the biggest thing. Be mindful of what we're doing, because that's what God asks us. He says, renew your mind. So what are we doing? Renewing our mind, thinking differently about what we do and how we do it. Lastly, I want you to talk about the role of fear. Because a lot of times we get fearful when we hear a diagnosis.
That's true. I was a psychology major in college, and fear is a powerful motivator. And of course, those people who have been paying attention to politics in the United States know that certain politicians use fear to manipulate their followers. And I won't name any names.
Yeah.
But fear of a diagnosis can make a person, avoid dealing with it. So they stick their head in the sand and don't deal with it because they don't want to hear bad news. And then the situation becomes worse. But there's usually a window of opportunity for every problem where you can fix it without too much trouble. It might not be trouble, it might not be things you want to do, but it's still fixable. And then the further away you get from that starting point, the harder it becomes to fix that problem. And that's the same whether it's a squeak from your car or a problem with your body. So that little ache or pain, could just be a little bit of arthritis in your elbow because of the job you do, or it could be gout in the elbow, or it could be something else.
But it's better to know
Exactly.
and be able to get it treated
Exactly.
than ignore it.
Right. And so many of these really bad things that can happen to us, the symptoms are very subtle or even non-existent until you go and you're seen and you're checked out and you get lab work and then something comes back that's a surprise. But at least we went and got the physical.
Right. And that was being intentional.
Right.
That was being intentional.
Right.
So I really appreciate your partnering with me, Dr. Miller, to take on some of these issues because one of my passions is to see God's people live at their full maximum potential.
Yes.
Be healthy, as my article said, healthy, wealthy, and wise. We can use wisdom. Health is our wealth.
Health is our wealth.
Because if we aren't healthy, it doesn't do you any good to have all the money in the world.
Right.
And you can't enjoy spending it.
Right.
And you can't, it can't do anything for you.
That's true.
It's like someone I know used to say, you can put you can be on your bed and have a table full of money next to you, and that money can't do anything for you.
Not a thing.
It can't do anything.
Right.
It cannot bring you a glass of water. It cannot bring you health back. It can't do anything.
Nope.
So it behooves us to be good stewards.
That's true.
It behooves us to do what we need to do to maintain our health. So in closing, would you like to have some final words before we end this session for today?
Okay. Well, thanks for asking. Definitely, I think being intentional about your health is the very best way to do. It's awfully frustrating sometimes as a physician when the problem that could have been addressed wasn't, and now you're giving the patient a diagnosis that really might not be fixable. And I was blessed today when a lady told me she didn't want to go for her colonoscopy, but she went, and there was a polyp, and they had to go back and get it because it was so large, but it was precancerous. So she got it out, and it won't be cancer.
Wow.
So she didn't want to do it, but she did it, and she beat it. Because now she's just a person that had a history of polyps. But if she had not gone, how much longer would it have been before that polyp became cancerous? No one really knows. But it was going to turn into cancer. And so she was going to have had a much harder, as old folks say, row to hoe if she had delayed a year or so. But she did what she didn't want to do. She had the colonoscopy.
Wow.
And she beat something that she really didn't want to do, which would have been, some portion of her colon removed, and chemotherapy, and tons of office visits, for years and years and years. So she beat all that with just one test.
Wow.
Yeah.
So be sure and ask your physician if they haven't done it for an A1C.
A1C for your diabetes.
For your diabetes.
Ask when it's time for your colonoscopy. Ask about your mammogram, ladies. And some men will actually opt to do mammograms, and that actually is indicated for men as well. But ask about all the screening tests. Pardon me. Ask about all the screening tests that are appropriate for your age and family history, and be intentional.
So guys, thank you all. For those who are going to come in on the replay, if you have questions, feel free to type them into the comments, and I promise you that I will get with Dr. Miller and we will get answers for your questions that you have. We're going to continue to have discussions on subsequent shows about your health being your wealth. So we're going to explore this a little bit more in terms of how we can stay healthy. And the other thing is that just because you have something now doesn't mean that you can't start where you are.
That's true.
Be intentional.
That's true.
And get healthier, right?
Just like my patient did.
Just like his patient did. So don't feel defeated. You know, if you've already diabetic or if you already have heart problems or whatever, do what you can at your level of ability. Get up and walk around. Go to your mailbox. You know, walk from your sofa to the TV and back a couple of times. You know, there are exercises for people that can't move around. You know, I saw one where you can pick up some canned goods
and sit them in your hands and sling them while you're sitting down.
While you're watching TV. You know, sit there and do the exercises. Lift your legs.
Lift your legs, exactly.
While you're sitting. So we're going to talk a little bit more about some of these too in the future, because just because you got something doesn't mean you got to accept it and get depressed and woe is me, I'm diabetic, I'm this, I'm that, woe is me, I'm going to die. And the other thing with the fear, I'm going to have to get my legs cut off or my toes cut off or whatever. That comes only with real out of control.
Severe, out of control, exactly.
Right. And we're a lot of times an accumulation, would you say, of lack of care.
True.
And an accumulation of failure to do some of the necessary things.
Non-compliance is what doctors call it.
Non-compliance. So we are looking to have a more compliant Christian and a more compliant disciple of Christ, because we need to be examples of what Christ would do if he were here. And I honestly believe that Christ would be here. He wouldn't be sitting down eating a bowl of ice cream every night and going to sleep, you know. And he walked everywhere he went.
Exactly. Yeah.
So he was exercising and he was active.
Right.
And I'm sure he was picking berries along the way or whatever. So we got to do some things better. So y'all, I thank you all for tuning in with us. Y'all give us some comments. I see there are a lot of people on the line, but give some comments. Let us know what you think about the topic. Let us know what you think about the discussion. Let us know any things that you want us to follow up with, and we'd be happy to do so. So until next time, y'all be blessed, be healthy, wealthy, and wise.
Take care.